How to get treatment for hepatitis C. Hepatitis C is a viral infection that attacks the liver and triggers chronic inflammation. Most people who have hepatitis C don't notice any symptoms until it damages their liver, typically after many years. Due to its destructive nature over time, hepatitis C is often considered more serious than hepatitis A or B infections, and it is the most common reason in the United States for needing a liver transplant. The hepatitis C virus (HCV) is usually passed between people via contaminated blood, commonly from sharing needles during illegal drug use. Antiviral drugs are the main treatment for HCV, although prevention and lifestyle changes are also important. Getting medical treatment for HCV. Consult with your doctor. Initial symptoms of hepatitis C infection occur within the first 6 months of infection, acute HCV, but they are often mild and, most of the time, may not appear at all. Only 20 to 30% of people with HCV show acute symptoms. Chronic HCV is usually asymptomatic. People with chronic HCV usually have chronic liver disease as well. Symptoms relating to chronic liver disease include fluid accumulation in your abdomen called ascites, swelling on your legs called edema, itchy skin, spider veins on skin, bruising, reduced clotting ability of blood, unexplained weight loss, drowsiness, confusion and slurred speech. Your doctor will order urine and blood tests that look for HCV and high levels of liver enzymes, which indicate liver damage. In more advanced cases, your doctor may recommend a liver biopsy, taking a small sample of liver tissue via a long, thin needle and looking at it under a microscope for evidence of injury. Be honest about your drug use. When consulting with your doctor, it's important to be honest about a past or current history of injecting illicit drugs, such as heroin, because it's the biggest risk factor for contracting hepatitis C and many other types of infections. Depending on your family situation and history of drug use, social services may be informed and have to get involved. If you're pregnant and using illicit drugs, your doctor may feel compelled ethically or forced by law, depending on the state, to force addiction treatment on you so your baby is not harmed any further. 5. Getting treatment for your drug addiction is just as important, if not more so, than dealing with hepatitis C infection. Seek addiction treatment immediately. Talk to your doctor about antiviral drugs. Once it's established that you have hepatitis C, the primary and only medical treatment is with antiviral medications that are meant to clear the HCV from your body. Newer types of antivirals tailored specifically for HCV are classified as either protease inhibitors or polymerase inhibitors and include boceprevir, Victrelis, telaprevir, Incivic, Cimeprevir, Olizio, Sofosbuvir, Sovaldi, and Decladisvir, Declinza. 8-9. The goal of antiviral treatment is to have no HCV detected in your body at least 3 months after you finish the medications. Although drugs to treat hepatitis C have gradually improved over the decades, they still have serious side effects, such as flu-like symptoms, debilitating fatigue, hair loss, depression and destruction of healthy red and/or white blood cells. 10. Take the antivirals as directed. Older antiviral medications were typically taken daily and for up to 72 weeks to be able to rid the body of HCV, but side effects were a common concern due to toxicity. Newer antiviral drugs tend to be more effective at killing HCV, so they can be taken for shorter periods of time, daily for between 12 to 24 weeks, and consequently lead to less serious side effects. Sometimes combining newer antiviral medications with existing ones, ribavirin with interferon, for example, can be more effective than solo drug therapy. Interferon therapy is given by injection by your doctor, but most other antivirals are taken orally as pills at home. It's best to always take antivirals pills with food or after meals. Regimens and dosages of antivirals vary depending on the hepatitis C genotype, extent of liver damage and other medical conditions. Prepare for the possibility of a liver transplant. If your liver is severely damaged and it's not functioning properly, then a liver transplant becomes a possible option. During a transplant, the surgeon removes as much of your damaged liver as possible and replaces it with a healthier liver from a deceased donor or a portion of healthy liver tissue from a living donor. Liver tissue actually grows relatively quickly and can regenerate itself better than other organs. Realize that a liver transplant is often not a cure for hepatitis C, as treatment with antiviral drugs typically must continue. Certain things can make you ineligible for being on the transplant waiting list. You must, for instance, stop drinking alcohol to be considered for a liver transplant. Talk to your doctor about what you must do to ensure a place on the list. In approximately 50% of the patients with chronic hepatitis who get a liver transplant, the HCV infection recurs and causes liver injury again. 13. The 5-year survival rate after a liver transplant is between 60 to 80%, depending on the surgical expertise, health of the new liver tissue and lifestyle of the patient.